to have true healthcare reform and not health financing reform, we really need to help people create health. The reason for the spiraling healthcare cost is not because of irresponsible insurance companies. The healthcare costs are rising because we've got a lot of unhealthy people. To cause a clot and block. I'm currently on the board of directors of the American Academy of Private Physicians, and through this organization, I've been introduced to many innovative technologies, many innovative testings that are going to really impact my patients' lives and implement into what I now consider a third era of medicine practice. The first era of medicine was the beginning of time. That was the era where our main focus as health providers, didn't have a lot of tools at that time, was to battle infectious diseases. That's what killed people. So once we had improved public health, once we had antibiotics, once Elvis got his measles immunization in 1958, we transitioned to the second era. It's the era of combating chronic diseases. We started getting terrific heart surgeries, started to be able to identify and treat cancers. And throughout the last 50 years, the amount of technology, medicines, treatment options have been fabulous to, once we find the disease, and fix it. So the mindset of every physician in the country is finding the disease and fixing it. And the third era needs to be a new mindset among all health professions to participate to help our patients create health and have more good years. Within creation of health, we're helping to take a person who is not yet sick, has not developed a problem, and prevent them from ever going down the path to sustaining that illness. So as I'm identifying patients with disease, I would have a subset of patients who I couldn't find a cause for the problem. Well, then when I discovered the amazingly strong association between mouth disease and the things that I do treat, like blood pressure, diabetes, heart attacks and strokes, even things like pneumonia and a whole long list of systemic diseases that can originate from disease in our mouth, that was another turning point in my career. Once I looked inside the mouth, I found the source of a lot of problems in people who otherwise might not have had their problems identified.
The mouth. It is such an important part of the human body, yet often overlooked when we think about our overall health.
The mouth and the rest of the body relate anatomically and functionally, and that's why the oral systemic connection is absolutely inherent in the way we're put together. So the mouth shares the same communication systems with the rest of the body. But then the mouth itself has some key physiologic functions that make it essential for our health and well-being. We eat through our mouths, we breathe through our mouths, we protect ourselves through our mouths, we have immunity through our mouths. So all of the basic body functions that keep us going on a day-to-day basis involve primary functions through the oral cavity.
From a disease standpoint, when we have different situations in the mouth, we respond, our body responds with inflammation, and that's where we start the inflammatory cascade that's affecting most of these inflammatory diseases. I want you to think about this. Inflammation, and there's a concept called inflammatory burden. When you get more inflammation in your system, the accumulation of that will have a tipping point where you tend to have inflammatory disease. Inflammatory diseases are heart attacks, strokes, diabetes, rheumatoid arthritis, various cancers, kidney disease, pancreatic cancer. The list goes on and on and on.
Periodontal disease, periodontitis, gum disease, whatever you call it, it all begins with bacteria. Bacteria are microscopic organisms, and in your mouth, there are billions. Over time, these bacteria can stick together and multiply over and over again. They can then form a colony and join together to create a thick layer called a plaque biofilm. Then, over a short period of time, it can dramatically spread throughout all of your mouth, teeth, gums, tongue, cheeks, everywhere. If there's an opening in your bloodstream in your mouth, the harmful bacteria can enter, causing the body many sicknesses. But there is another problem that occurs in response to the bacteria as your body tries to fight back. Inflammatory cells are triggered to try and kill the bacteria. But bacteria build their own strong defenses and battle back. This microscopic war ensues, and the result? Chronic inflammation. And inflammation is the basis for so many diseases.
With the dental patient, you have an infection in your gums. The total area of your gums is about the size of the palm of your hand. If you looked at the palm of your hand and you saw an open wound the size of the palm of your hand, would you just decide not to do anything about it? And yet people are choosing every day not to address the infection in their mouths. People think that it's normal that when they brush their teeth, their gums bleed. And I don't know where they came up with that.
If there's a little blood in the sink, it means they've got a problem. The bacteria that cause inflammation in the mouth will typically cause inflammation in the rest of the body. Yet if there's a little inflammation between the teeth, it means that there's a problem where those high-risk bacteria may be getting into their bloodstream and cause any one of the many systemic diseases that can originate from bacteria in the mouth.
I'd like to stand back and realize that there's some untreated inflammation here and look at the root cause. And
10 years ago, I found a gentleman by the name of Dr. Bradley Bale who was doing family practice in Spokane, but had been kind of taking a special focus on disease, vascular disease, versus just general family practice. So we joined forces at that point. I worked with him in family practice, and then in about 2001, 2002, we decided to close the family practice and spend 100% of our efforts on vascular health. And the reason we did that is because so many people are told they are fine based on their risk factor profile, based on their age, their gender, and all of those risks, and they are harboring silent vascular disease. And the reality is, it's the vascular disease coupled with inflammation that really causes events. And that's really where the Bale-Donine method got going and started, is that we are doing something different. Rather than focusing on a risk factor paradigm, we're focused on a disease treatment paradigm.
how was your last dental checkup?
When patients come in, sometimes they're surprised when I really dig deep into their oral health, and I talk to them about what their dentist says when they come in. I ask them if they floss, and if they don't, I ask why. And it's a great conversation to have because it allows me to demonstrate that the oral cavity has systemic impact.
We've always had a keen interest in the health of the mouth in our work to prevent heart attacks and strokes, and that is just intensified as the science has evolved. We now have great science telling us that the cause of arterial disease is inflammation, and another source of arterial inflammation is infection in the mouth. With the most recent study coming out, it actually implies up to 50% or more of acute heart attacks are triggered by oral infection. That's huge. Heart attacks are the #1 killer in this country. Strokes are the #1 cause of disability. The current cost of cardiovascular disease to our healthcare system is about $518 billion. And it's all preventable. And about 4 years ago, we felt our method, which we call the Bale-Donine method, had evolved to a point where we could actually guarantee our work. So that means the patients that I personally treat, if they were to suffer a heart attack or an ischemic stroke, the fees they paid to me for my service that year I would refund. So we get extremely high-risk patients, which is fine. I like a challenging patient, and I do believe you can shut down the disease process in anybody.
The total total estimated cost of diagnosed diabetes in the U.S. in 2012 was $245 billion. Medical expenditures for people with diabetes are about 2.3 times higher than for people who don't have the disease, due largely to the complications of the disease, whereby a decrease in the immune system's ability to fight off infections leads to its complications. Periodontal disease is one of those infections which can adversely affect the diabetic patient.
Inflammation sets up a reaction that causes things in our body that makes us less responsive to insulin, which is how we develop type 2 diabetes. So whether it is inflammation from just a fat belly, or whether it's inflammation from gum disease, or whether it's inflammation because you've got a chronic abscess someplace, it causes the same process of a resistance to insulin, which leads to type 2 diabetes, or is the hallmark of type 2 diabetes.
Your blood sugar will not go down if you have an active periodontal infection, because when you have an infection of any kind in your body, it stimulates your liver to release sugar because your body wants to fight off that infection, and it needs that sugar to go into the cells of your body to give your cells the energy that it needs to fight off that infection. The problem is that when you get that blood sugar released into your bloodstream, it can't get to where it needs to go. We don't have the transport mechanism, the insulin, to bring it into the cells. And so the problem never goes away, okay? It can't fight off the infection. So diabetic patients understand that they'll say to me, yeah, I can't fight off infection very well. And they're exactly right. Their bodies do not fight off infection. That's why they have wounds, and that's why they have a lot of chronic conditions. The other thing is that sugar is just what bacteria feeds off of. Okay, so if you have an infection in your mouth and you have high blood sugar in your system, you're giving that infection exactly what it needs to grow. So it's a catch-22, and it's not going to go away.
We carried out a study where we asked the question, which comes first, diabetes or periodontal disease? So we took a group of individuals who did not have either disease, periodontal disease or diabetes, and we followed them for years. And this is one such case. This is a 35-year-old female with neither periodontal disease or diabetes. She was a happy young woman, and everything was just fine in her life. And then, about 3.5 years later, she developed very severe periodontal disease. And you can see the loss of bone in this area and upper teeth. So much bone is lost that the teeth have actually migrated. Some of the back teeth have so much bone loss that they're about ready to fall out. And this is what she looked like clinically at the time of the second visit. You can see the teeth have spaced. There's actually, there are abscesses, which are gum boils, which hurt. What we found is that in the time between the two visits, she also developed diabetes. And periodontal disease will actually lead to, be one of the factors in the initiation of diabetes. Now, there is another facet of the relationship between periodontal disease and diabetes, and that is if a patient has diabetes and also has periodontal disease, the periodontal disease makes diabetes worse. So it's a wonderful example of the interaction between the mouth and the body in both directions.
Surprisingly, the U.S. ranks 6th among the top 10 countries for premature births, with 1 in every 9 babies, or 500,000 babies, born prematurely annually in the United States. Pregnant women with periodontal disease are 7 times more likely to go into preterm labor. Maintaining a healthy mouth during pregnancy plays a critical role in the prevention of preterm birth and its serious consequences.
Being a researcher at the dental school, my focus is on oral microbiology. So how oral bacteria cause infections in the mouth and elsewhere in the body. In 1996, a study was published and provided the first evidence that women with periodontitis has a tendency to deliver premature and low birth weight babies. So since then, there have been a lot of epidemiological studies to link periodontal disease with adverse pregnancy outcome. Even these mild periodontal infections, when it occurs in combination with some other secondary infection, could cause severe adverse outcomes. And for periodontal disease, it tends to be ignored because it doesn't kill. But I think what we're showing here is periodontal disease does kill, because if the bacteria gets into the blood circulation and gets to the uterus, it could kill the baby. Based on what we have seen, oral bacteria could account anywhere between 10 to 30% of these intrauterine infections. So it is a very significant cost. Not just financially, but it's also very emotionally, because if a family loses a baby, it's detrimental. People are very hurt, and they're hurt for a long time. And so they want, the question I'm always asked is, what did I do wrong? What can I do to prevent this from happening to my family again? So I think that's the big question that we want to answer.
In addition to causing birth complications, research studies have shown that women who have gum inflammation and infection and are undergoing infertility treatment have delayed results. It's much more difficult for them to get pregnant. This has been attributed to the extra hormones they are being given, which are being absorbed into the estrogen receptors we have in our gums. And in the presence of plaque germs in the mom's mouth, they cause inflammation, bleeding gums, and infection. But it stands to reason, whether a woman is taking infertility drugs or not, if she has bleeding gums, infection, or even if she just has high levels of bacteria in the mouth, then the body is going to be in a state of poor health, and pregnancy might not be possible. In American hospitals alone, the Centers for Disease Control estimates that hospital-acquired infections, an infection you didn't have when you came into the hospital but got while you were there, account for an estimated 1.7 million infections and 99,000 associated deaths each year. And for some of those who survive the infection, their lives are changed forever.
I'm an advocate for patient safety, and I have a passion about it. They call it obsession where I work, but it's just a passion because I love to protect my patients. That's what I do. One lady told me, I asked her if she had periodontal disease, and she said yes, she knew she had it, but that it was expensive to treat. She didn't have dental insurance, and she was having a total knee put in. So she had her total knee. She went home. A few months later, she got infected. They had to take her knee out, and then she had to live without a knee for a while. And then they put a new knee back in. It got infected. They took it out, and when I was her nurse, 2 years later, I was her nurse, they were amputating her leg. And she didn't know anything about periodontal disease, but she had an infection. And when she went into surgery, her husband told me that the cost of their medical bill for the past 2 years was $2 million.
They now tell us that half of America has a condition known as periodontal disease, which is more significant and more severe than gingivitis, which people get from time to time. But half of the people, what it says to me is half the people that now go into surgery have this condition. There are a couple of ways that this is a problem. In surgery, it's not that the bacteria from the patient's mouth is going to end up in, say, like a knee surgery. It's that the body can only fight infection on so many fronts. And it's like a war. It has a certain amount of resources it can allocate to that fight. And when you have an infection elsewhere in your body, it's allocated resources to that infection site. And then when you go in and do a surgery, you create another wound, and that wound demands that the body put attention to it too. So the reason you don't do surgeries on patients who have infections is because it diminishes their ability to recover from the surgery and increases the likelihood that any other bacteria could then take hold because there just aren't enough antibodies to fight that infection. From a financial point alone, if you look at the cost of a standard post-operative infection, it's between $15,000 and $30,000 per incident. And that's a cost that's generally borne by the hospital itself. But if you really want to know the truth about what we're being able to do, when you look at the long-term care industry, 90% of those patients have an oral infection. 90%. And when you think about that, and you realize these patients have a lot of other conditions. They have heart disease, they have diabetes, they have ulcers, they have pressure wounds. All of these are made bad or worse by this periodontal condition. The real good news is that there are easy, non-surgical ways of correcting the condition that you can get from your local dentist.
It's clear to see that the inflammatory burden caused by periodontal disease is a serious problem. But the mouth is also the home of many other preventable chronic diseases that plague our society, some of which goes untreated and undiagnosed for years. The mouth is also home to one of the biggest killers in our country, oral cancer. Every 60 minutes, one person dies from oral cancer. That is one person every hour, 24 hours a day. Sadly, it affects people of all ages, nationalities, and walks of life.
My first appointment here was September 29th of 2008. That is when I was given my diagnosis. It'll be 5 years in September.
Denise is one of, unfortunately, a typical story. A typical story in the sense that here is a patient that's been pretty healthy and doing well, and has some growth in the mouth, and typically by the time it is recognized as an advanced stage.
It all began in July of 2008. I had a broken tooth, and I went to my regular dentist, and he said, I need $13,000 in dental work. I have an abscess. He gave me an antibiotic, and that was it. And I told him I don't have the $13,000 to do the dental work right now. I couldn't worry about it. I was a single mom raising my 2 children. I went through a horrific divorce just 2 years prior to my diagnosis. So I let it go. About 2 months later, I broke another tooth. So I went over there to go see Dr. Israel, and he looked, real quick, and he said, oh, this is terrible. We need to do a biopsy and a 3D CAT scan immediately. You have a growth in there.
She already presented with what's called a stage 4 disease, meaning that the tumor had grown substantially, not only in size, but also had metastasized, had gone to the lymph nodes in her neck.
Nobody caught it in the beginning. So if it was caught originally, it might have never turned to stage 4. I might still not be battling what I'm battling now. There is a way to detect oral cancer in a dentist's office immediately when you go for your cleaning and checkup every year. All they have to do is screen you for it. It takes a minute for them to do it. Between what my insurance has paid, donations have paid, anonymous donor has paid, I have to be at least up to $4.5–5 million in medical. It's early detection, preventative health care, and all the money that was spent of 17 operations could have been prevented.
A recent study by United Concordia, the largest of its kind, looked at the health of over 1.7 million people and found that almost 200,000 had both chronic conditions and gum disease. Then they looked at those within that group who were treated for their gum disease and those who weren't. The financial savings annually by those treated were impressive. Diabetic patients treated for their periodontal disease, $3,291. Patients with heart disease treated for their periodontal disease, $2,956. Stroke patients treated for their periodontal disease saved $1,029. Patients with rheumatoid arthritis treated for their periodontal disease, $3,964. And pregnant patients treated for their periodontal disease saved on average $2,430. All this simply by getting a healthier mouth.
The source of what has to shift in dentists is that they're trained to find the chief complaint and fix it. That's a reactive care dentist. They walk into a room and they ask the patient, is anything bothering you? Is there anything wrong? Now the dentist is looking through a wider scope, a wider viewfinder, and now being a screener, looking at a wider context of treating the whole person versus just the mouth. And we're not saying dentists are going to replace medicine. No, they're now partners with, and they are the first line of defense because the mouth is that first indicator. And check this out. 9 out of 10 patients who go to a dental office do not have a primary care physician on their medical history form.
The dentist, the hygienist are critical to maintain vascular health and wellness. It can't be done alone. And then from the other side, the dentists and the hygienists need to realize that their work has systemic merit. So both communities, medical and dental, need to start talking.
People are impressed by that type of dental care. And as physicians, we need their help. Because there are a lot of people out there, they won't see a physician in a year. Most patients will see a dentist at least once or twice a year. So their exposure to these people is higher than ours. And they all need to be educated on this, because it's not just the physicians who don't recognize this link. Believe it or not, there's some dentists, I think, you still don't believe it, or they're not on board with it. That's got to stop.
The public, government, insurance, caregivers, and even dentists themselves have to begin to think of dentistry as part of the first line of defense against disease and sickness. The distinction between the standard dentist and a complete health dentist is extremely important. The standard dentist does a good job of taking care of teeth in the mouth, but a complete health dentist focuses not only on care of teeth and the mouth, but also cares for the complete health of the individual. By taking this new approach to their profession, hundreds of dentistries and dental schools across the country are joining the complete health dentistry movement.
The Arizona School of Dentistry and Oral Health is very unique. One of our mantras here is that it's not about the tooth, it's about the person attached to the tooth, the family attached to the person, and ultimately the community attached to the family. We want to produce doctors that are leaders in communities and along the way teach them to be great doctors that are engaged with that community.
I know we're going to make some vast changes in people's lives for the better. We're going to save a lot of lives. We're going to improve a lot of health. We're going to save a lot of healthcare costs. And I have no doubt that the world will be a better place because of all the work all of these passionate individuals are doing.
There doesn't have to be any one hero. There just has to be a whole lot of heroes working together.
One of the keys in everyone getting healthy is decreasing inflammation. And the most powerful thing we know about decreasing inflammation is taking care of your gums. And dentistry has a key role in that.